Okay, we're going to talk about, is it okay to eat sodium? So sodium is really short for sodium chloride, eating salt. Sodium is actually a problem in nutrition because our ancestors, like the Yanomamo in South America, they only eat about 200 milligrams a day. That's correct, 200 milligrams a day. They have almost no hypertension. They're in their 70s, they got good blood pressure. That's a population in South America sort of separated from the modern civilization, eating primarily a plant-based diet with no added sodium. Other low dietary sodium populations that are also primarily eating plant-based diet and living in these remote areas, they don't have problems with hypertension. You go to rural China back before 1970, somebody eating a rice diet without added salt, they got great blood pressure. Rural Kenya and a whole bunch of other places, all of the rural places, they all got pretty good blood pressure when they live that way. Most people nowadays eating a standard American diet, in middle age they get fat and sick. They're quite often eating around 10,000 milligrams a day. Some people will tell you, oh, the average sodium intake is around 7,000. I don't believe it. I think it's a lot higher. Most people are eating worse, and sometimes in those surveys, people don't really say everything they're eating. If you just look at one bowl of cereal, typical cereal will have like 200 or more milligrams of sodium per serving. And if you eat the 15-ounce box, I would always eat the whole box whenever I eat cereal. One box of cereal, 3,000 milligrams, right? And there's actually, if you're eating whole milk or something, there's sodium in the milk, and that's going to crank up your sodium as well. Some additional things to be aware of. Guy by the name of Walter Kempner, he's a physician in North Carolina. He had a bunch of hypertensive patients he put on a rice diet, and he really, went out of his way to make sure their sodium intake was super low, 150 to 200 milligrams a day. They did very well with very good improvement in their blood pressure for many of them. Other things to be aware of, sodium pops up in all kinds of places you don't expect it. Soda pop, they'll put salt in there because they want you to be thirsty because it makes you more thirsty, you drink more. And then there's caffeine in there, so it's like a diuretic. So that combination of, and then they put lots of fructose in there so it tastes sweet. You drink it to get the caffeine and to get the fructose, and then the sodium causes you to want more. It's like a system to get you to buy more of their stuff. Don't ever drink soda pop. Soda pop just makes people sick. Processed food. For most people eating a standard American diet, they're going to get about 75% of their sodium from eating processed food. So it's obvious right there what you should do. Stop eating processed food. Why do you want to reduce your sodium? Because you don't want to end up hypertensive. Sodium is a vasoconstrictor. When you vasoconstrict the arteries, you have to increase blood pressure to pump blood through them. And hypertension over time, it's like a #1 risk factor for having a stroke, for having a myocardial infarction, dramatically increases your risk of becoming demented, going into kidney failure, all these bad things you don't want. You're going to hear things like, oh, low salt diet, 2,000 milligrams or less. That's bogus, okay? If the normal proper intake is 200 milligrams a day, 2,000 milligrams a day is 10 times too much. I think you should try to at least be under 500 milligrams a day. Sodium is a vasoconstrictor because it leads to inhibition of endothelial cell, the lining of arteries. They're nitric oxide. Nitric oxide is a vasodilator. So the other thing is when sodium is elevated, it has a reciprocal relationship like a seesaw with potassium. K plus is for potassium, Na plus is the symbol for sodium. So when you're increasing your dietary sodium intake, you're actually going to end up having more of that sodium taken in by your body. You're going to be having a relative loss of potassium. Every cell in your body has to maintain sodium and potassium gradients. And when you elevate the sodium, they're the two most common cations, positive ions intracellularly. And when you're increasing sodium, you're reducing potassium, and that messes up the cell's ability to maintain good sodium-potassium gradients across its plasma membrane. It does so with a sodium-potassium ATPase pump. That means an ATP energy-powered pump in the plasma cell membrane to pump out 3 molecules of sodium and take in 2 molecules of potassium. That maintains a slight negative charge within the center of the cell. And that cellular gradient, both of a chemical gradient and of an electrical gradient, is used by the cell for other types of pumps. The cell uses that to run its calcium membrane pump exchange system. It uses that to maintain its hydrogen proton exchange system across the plasma cell membrane. So what I'm trying to say is when your sodium intake is high, you don't just become hypertensive, you damage the gradients of every single cell in your body. You're making your body sick, you're screwing up your metabolism, and you're predisposing yourself to a lot of complications down the road. Other things to be aware of, we talked about fructose causing increased sodium absorption in the gut, increased retention of sodium from the kidney. Another not well-known fact is when you have elevated insulin, associated with prediabetes, diabetes, when insulin is elevated, it causes increased retention of sodium by the kidneys, and that'll cause volume expansion of your blood volume, and that'll cause hypertension. So what's the point? Diabetes and hypertension go together. Okay, so you don't want this. You want to minimize your intake of saturated fat to decrease your tendency towards developing insulin resistance and thereby decrease your risk of hypertension. The most common reason people end up on kidney failure, on hemodialysis, is because of diabetes and hypertension. And if you talk to a neurologist, I told you I got my 3 neurology friends, I ask them what's the most common cause of stroke. One says hypertension, the other one says diabetes, the other one says atrial fibrillation. They're all related to the same thing, atherosclerosis and problems like this of hypertension. Hypertension is the #1 risk factor for atherosclerosis. #1 cause of death is atherosclerosis in the heart, coronary artery disease, myocardial infarction. #2, cancer. #3, stroke, depending on how you look at the numbers. But the bottom line is you want to avoid all things. So what's my advice? Don't add any salt to your food. If you absolutely have to, put a little bit on after you've cooked it, then it's more noticeable. But keep it to a minimum. And yeah, you want to minimize your sodium intake. You'll be a lot healthier. Oh, actually, I want to show one last thing in case we didn't end yet. You look at this, the quinoa, 0 sodium. You look at this, oatmeal, 0 sodium and a bunch of potassium. You look at blueberries, 0 sodium and a bunch of potassium. So what's my point? P for plant foods, P for potassium. Unless you're in advanced kidney failure, you want to increase your potassium intake, reduce your sodium intake. You know what you could do? You could get one of those salt substitutes that has potassium in it and less sodium or no sodium in it. That'd be a reasonable thing to do. You always want to make sure you got iodine in your salt as well. But just be aware, sodium tends to be bad for you. And no animal besides modern crazy humans with their processed diet eats more sodium than potassium. It's a recipe for making yourself sick.